Hello, welcome back. We are on the 4th day of our 5-day webinar series where we are speaking about taking control, navigating obesity treatment, and advocating for care that you deserve. If this has been beneficial for you, if you've learned something, please do not gatekeep it. Share it with your friends and neighbors. We all need to be our healthiest self, all right? There's a lot of great nuggets within the series. The first part, we talked about obesity, how it's defined when it became a chronic disease in 2013, and why does it matter? We talked about the multidisciplinary approach, which anyone, whether you or your loved one, if you are facing a diagnosis of diabetes, how should that be adequately managed, okay? And then we dived into the treatment options with a focus on medication, but definitely we know that the current landscape, foundational is always lifestyle. So it's always and, right? So it's medication and lifestyle, nutrition and behavioral change, or just something combined. It's never one thing. So if you ever have a doctor or a provider that tells you it's a one size fit all, it's only one medication that you can use, only one thing you can do, that is someone you need to run far away from, because it's not a one size fit all. It's a combination. It's a multidisciplinary approach. All right. So at the second and third, I mentioned about nutrition, physical activity, sleep, right? Stress management. And then we dived into the different medications with a focus on the tablets that we have, first generation, second generation, and really what the GLP-1s are, what the GLPs with the GIPs, just really diving into these different medications. What I love about these medications is that they're evidence-based, right? They're effective, they're safe. Yes, they're expensive, but several organizations, as well as the companies itself, have, with a lot of competition, have said it to decrease accessibility and affordability to these medications, okay? Definitely the reason why I'm doing this series is that I want to make sure that you stay educated and you don't feel overwhelmed with all the pressure of all the information that is out there. I see so many posts online. Where should I get this? My doctor doesn't want to give this to me. I'm being bullied. So many questions. Is it approved for children? What age is it approved for? In this episode, we're going to dive into the medications, who it's for, what are the indications, and what are the contraindications. All right, so that's what we're going to talk about. Now, I want to start off by saying that these medications work with your biology, okay? So we start by, what does it do? It works with your biology. It doesn't work against it, okay? And knowing that, we know that the medications itself are life-changing, right? But it could be dangerous for the wrong person and absolutely fabulous for the right person, okay? So that's why we need to know who are the right people. So when it comes to who is the right candidate, if it's going to be paid by insurance, there is an indication based on the BMI, the basal metabolic index, which is 27. So if you have a BMI of 27 with chronic lifestyle-related diseases, that is an indication. Or if it is BMI greater than 30, even without chronic lifestyle-related diseases. And if you remember the chronic lifestyle-related diseases are things that are impacted either because of sick fat disease or sick or mass fat disease. So the pressure of the excess, the adipose tissue, the extra pressure, or the inflammatory process that happens due to the adipose tissue. So whatever effect that comes from that is what we call chronic lifestyle-related diseases, okay? So who are the patients or who are the individuals that can benefit from these medications? Again, if you didn't watch part 1, 2, and 3, please watch them because it all follows. It's important to know, what are the medications and who would be the good fit for these medications. So certainly obesity, the diagnosis of, obesity, BMI greater than 30, that's obesity. Overweight is BMI greater than 27. Now, in my practice, I don't just look at BMI, I also look at your in-body scan, which breaks down your body composition into fat mass, into visceral fat. That's the dangerous fat that I am all triggered about because I want to make sure that we attain metabolic health. All right, so obesity, diabetes, metabolic dysfunction is also another indication for the medication, and hormonal shifts and life transition. So those are all the indications. It's highly individualized. Again, it's not a one size fit all. Now, let's take a deeper dive into the benefits. How does it work? Okay, so it works. There's certain things that happen. It decreases hunger, increases fullness, it decreases craving, and it slows down gastric emptying. So anytime we eat, right? Anytime we eat, there is a signal that, oh yes, you're eating, at some point you're full, stop eating. So what this does is that it actually avoids any delay between the gut and the brain. And it works at the brain center, it works at the intestine center, it works at the pancreas center, it works even at the adipose tissue center. So it works at several stations, and I call them stations, but different areas of the body to ensure that you know when to stop eating and you don't even think of it. And that's why they say the food noise, it's no longer there. I had a patient just this week said, wow, it's a miracle. I'm not even thinking about food. I can actually live. I can get stuff done without thinking about what I'm going to eat. I can actually live. There is a real thing as food noise. Food noise. We do the best we can, but some people are just wired that way, where you're always thinking about food. And then when you eat the food, you don't know how to stop. And so it's more than just eat less, move more. Okay, sometimes I think it's that simple. But again, if you remember my definition of obesity, it's a what I'm trying to get the word out of my head. So biology, but neurobehavioral as well. So several things have been channeled and have been affected. So the additional benefits that we see from these medications is that it decreases heart attacks, strokes, diabetes progression, also sleep apnea, all right, and fatty liver disease. As the studies have gone on more and more, especially for the GLPs, they found more and more reasons, more than just diabetes and weight loss, that these medications have been very beneficial. Pointing to note, tirzepatide, which is the Zepbound, right, and the Mounjaro showed that 97% reverted from pre-diabetes to normal. Isn't that amazing? And then semaglutide, which is the Ozempic, and the Wegovy showed a decrease in heart attacks and strokes by 20%. And same thing with sleep apnea. So very, very important. So to summarize how these medications work, appetite regulation, okay, and satiety signals, and then it slows down gastric emptying. So pay attention to how these medications work, because that's how you know what kind of side effects can come about and how you need to eat and what approach you need to be able to stay successful on these medications, okay? All right. It also helps with blood glucose control and insulin sensitivity. And this is what I love about the medications. It makes your insulin more sensitive. It's not resistant. It's not resistant. It's not storing fat. So we all need to be more insulin sensitive. And unfortunately, as we get older, for several reasons, whether it's hormonal, environmental, stresses, our insulin is just not responding as well as it needs to. But these medications have been shown to help with that. Of course, there are other things that can help with insulin sensitivity, but the medications have been shown to do that. And there's also that brain-gut connection. There's been studies that show that it actually helps to trigger the good microbiome in the gut, which is a good thing, right? So several benefits. So not everyone, just to emphasize again, not everyone needs it, but the right person can benefit from getting it. All right. So great information about these medications. If anyone comes to you and they make you feel bad, I want you to realize that it's getting to the root cause. Okay. So the root cause, metabolic dysfunction and hormonal regulation, as well as whole body impact. All right. And it's very, very different from other drugs that are out there. Now, having said that, though, there are several things that we're going to talk about in the next video, which is going to be tailored towards how different individuals respond differently. So you hear different people's experiences, but everybody is different. So you want to just know who are the super responders, who are the moderate responders, who are the sub responders. All right. So you don't know what category you are in until you try. So it's always important. Also, the way I practice, again, it's always patient-centered, personalized. I want to make sure that I'm very safe with my patients. I make sure that they don't have any reason why they can't take it. And reasons will be such as, any history of thyroid cancer, specific cancer, which is the medullary cancer. And, I've had patients tell me, oh, I've heard that you can cause cancer. The studies show that patients that actually had those cancers are patients that they needed to exclude from the study. Pancreatitis, any inflammation of the pancreas, and that's just, again, because it does act on the pancreas wall. So that was part of what they found during the studies. Acid reflux, because when there's slowing down of the gastric emptying, because everything is slow, it keeps you full fast, so it takes a longer time to digest. Definitely anyone that has severe acid reflux are patients that just should not be on this medication. So it's so important that the timing when you're on this medication, if you have a doctor that is ready to escalate or jump, a level before going, that's not wise. That is not patient-centered. That is not safe for the patient. So in my practice, I monitor my patients closely. There's accountability. There's also support to make sure that they don't have any side effects. I have a manual that I share with them that tells you how to manage all the different side effects and how to prevent them from happening, right? So really setting you up for success is the main thing here. Okay, so now the question is, what are some of those side effects? And I want to share that with you because it's a question that comes up quite a bit. So certainly the most common ones is nausea, constipation, and acid reflux. And the way we guard against this in my practice is I just tell my patients, just make sure you're not eating too much food at once, right? It's gonna take some time to digest. So slow down how much you're eating at once. Avoid oily foods so that you don't feel nauseated, right? There's the fatigue that also happens at maybe the first 2 days. Stay hydrated, use healthy electrolytes, to rehydrate you. And then for the constipation, certainly fiber supplements can help, but I always say get it from your fresh vegetables, right? Make sure you're moving. All of that will help you from being constipated. Some other people have diarrhea. So these are the most the very common side effects that tend to happen. But the ones that we don't see a lot of is like maybe gallbladder, gallstone issues. We've had some pancreatitis. Don't listen to everything you hear on the news that somebody died from this. You don't know the whole story. You don't know the whole story. You don't know what happened to the patient. So just be very careful listening to everything that you hear on the news. So yeah, so there you have it. We've dived in quite a bit into how the medications work, right? All weight loss medications have a similar pattern, but the GLPs even take it to a higher level. Depending on the different classes, there's a certain percentage of weight loss that is achieved, right? Some as early, the earlier medications are anywhere maybe 10. When it comes to the pill, the first generation, anywhere from 10 to about 12% body weight loss. And then when you start hitting the semaglutides, maybe 15 to 20, and as you hit the tirzepatides, they go up a little higher, 30 to 35. So there's more weight loss to achieve, but that is if you're monitored carefully. And in the next video, I'm going to share how you can avoid gaining it back. What can you do to incorporate, again, the lifestyle, which is very important. Mindset is also key. You cannot start this journey of weight loss without a good mindset, without a strong mindset. So we will talk about that in the last video. I would also share how you can advocate for yourself, how you can ask the right questions, and how you can work with me in case that is something that you desire to do. Remember, you deserve to live at your finest because you are worth it.